McKendree University is in a rural area, and so the nurses, all of our students most of them are from rural areas. And as you know, nurses are the most trusted profession, and so who better than to provide that strong, confident information about vaccines than our nurses here in Southern Illinois.
We're still less than 50% vaccinated, and in some of our smaller counties, we're talking in the 20s. So there's still a very large hesitancy with our vaccines.
This grant really is going to give us an opportunity to potentially impact thousands of lives. But one of the big strategies is looking at motivational interviewing.
Would you mind sharing with me a little bit as to why you've decided not to get the vaccine?
Nurses feeling confident to be able to talk to patients and say, tell me more about what your concerns are. Tell me about the information that you received.
I've heard that some people who receive the vaccination become really ill.
Also providing them the information they need and the tools so that they can give accurate information to the communities where they're practicing.
But those symptoms generally are mild and they do subside. And some individuals who have the COVID-19 vaccine don't experience any side effects at all.
Wow, really?
But we're also using something called a virtual escape room. We're addressing nursing students as well as college students.
We're starting with immunity and then leading into vaccinations at the same time. What are our vaccinations? When were they created? And then it will continue on leading into vaccination hesitancy. And with that, they're going to be looking at videos, different websites, and articles. And the goal of this escape room is to get to vaccination confidence. The community virtual escape room is actually going to also be provided to our critical access hospitals and our public health departments.
We're working with 38 public health departments. We're working with 57 critical access hospitals in the state. So from that standpoint, our nurses, we have strong partnerships.
Coming from public health, we really look at things of prevention, and that's our mindset. When you look in healthcare systems, they're generally treating something. We are looking at that prevention side to it. So sometimes even those collaborations, that's why they work so well. And so that every nurse has an understanding how community health and public health integrates into any career that they choose.
In August of 2021, we lost a beloved colleague, friend, mentor, and nurse here at SIH. As a colleague, we had had conversations. I knew he was unvaccinated. He was young, he was healthy, he was 36 years old. It was devastating. I think the number one takeaway is COVID doesn't discriminate. It doesn't care what sex you are, what age you are, how old you are. If you have the opportunity, if you have questions, seek out that guidance from your primary care provider, get your questions answered.
It's a healthcare crisis. I think it's really important for people to share their stories, and just being able to hear from various sectors of how this impacts even healthcare. I'm hopeful that it will change people's stance.
Is there any additional information I could provide you today?
I don't think so. I think I'm ready. Would I be able to get the vaccine today before I leave the office?
Sure, we can do it now.
If we have one person who gets a vaccine because of this grant, we've been successful.